The way that, or do you understand how insurance works, right? The
Sure.
way that insurance works is that when you're paying that premium, it doesn't go into your little piggy bank at the insurance company, and when you make a claim, that money's for you. You're putting that money into a pool. So when you say that you don't want to pay for other people, you're already doing that, or your parents are doing that by pulling all their by paying an insurance premium. All that money goes into a premium pool. So everybody who's part of that insurance company, they're paying into that same pool, and then when one person has a claim, it gets taken out that pool. So when you say that you want to pay for other people, your parents are already doing that. That's how all insurance works. The only difference between what I'm saying and what you're saying is that you think this should be handled by private arbiters who are gonna want to make a profit, and I'm saying this should be handled without a profit motive. Otherwise, we'll see a situation like Luigi. Cool. I appreciate you being up here. All right. So, human being, what's up?
Yeah, so you're lying when you say that Japan has free universal healthcare when this is not the case. They force you to buy insurance. There's two insurances, which would be for your employees or the national health insurance. So they force you to buy insurance. There's no such thing as free healthcare in Japan.
Okay, does Japan have universal health care? Yes, Japan has universal healthcare system. It provides comprehensive medical coverage to all residents, including citizens, permanent residents, and short-term visitors.
They cannot deny you based on hospital visits and needed surgeries, but they force you to have insurance. That's the law.
So, like here?
What do you mean here?
Okay, so the healthcare system in Japan provides different types of services, including screening examinations, prenatal care, et cetera, et cetera. Payment for personal medical services is offered by a universal healthcare system.
They
So
force
they
you to
do
buy
have
insurance.
universal healthcare.
There's no such thing as free. You have to buy into it.
Where they pay through their taxes?
No, it would be taxes and it would be the insurance that you have to buy.
So they through their taxes and their like so they have a mandated insurance.
Yes, so you have to get insurance, and on top of that, you would be paying
And
taxes.
there's a public system?
Yeah, so you cannot be denied once you go to the hospital. That's
Right.
pretty like standard.
So there's a public system if you don't get private insurance.
Yeah, but the thing that you're talking about is free universal healthcare. It's like the free is the one thing I'm not believing in.
All right. No one says free though. We all know universal healthcare is paid through taxes. We all know that.
Yeah, and then on top of that, they would have to purchase their own insurance,
Right.
and
So
then
they
the
have.
government would cover the rest.
So they purchase an insurance and the government covers the rest. So they have a universal system.
I mean, I guess that could be applying
That's
to anything
exactly
on
what I'm
earth.
talking about though.
Yeah,
That's
so
not
that
that's
could be a
but that's not the case in America. In America, we don't have a universal system. If you don't have insurance, you're just fucked.
well, I mean, I think through like the Affordable Care Act, you would have to buy the cheapest insurance. It's kind of like Japan, I guess, is
They
moving us
dropped the
towards
mandate.
it.
They dropped the mandate years ago.
No, they dropped the penalty. So Trump in I think it was 2017, he like you had to pay a penalty if you did not get the
Yo, what's
government
up? How you
insurance.
doing?
Yeah, which makes the mandate basically all but nothing.
So like you believe that this would be a better society if you were forced to buy government insurance. On top of that, you have to pay taxes.
No, I think those would be a better system if we had universal health care.
Yeah, so what would be the difference between the penalties of buying the cheapest government insurance, which would be Obamacare, and on top of that, you would be paying taxes to
That
cover the rest of,
that you don't have to buy into it. It will just be universal. We're already paying into it. We're already paying into a system that has universal care, which is Medicare. The difference between
Yo,
Medicare and
yo,
universal
yo, I
system.
gotta.
Hold on, Jock. The only difference between Medicare and a
Right.
universal system is that Medicare only covers 80%. You got to pay the rest. Under universal system, it'll just cover all of it.
But why should we cover everything? Well, why should the government be responsible for extraordinary care? So, like, let's say if you smoke a pack a day, well, not you, your neighbor smokes a pack a day. Why should this be, covered by the government? This makes no sense. This does not incentivize healthy habits in no capacity because they know that they could just walk in and not have to deal with the consequences,
That is a
the
wild
economic
take.
consequences and
Does
physical
that happen?
consequences
Does
of
that happen
smoking a
now?
pack a day.
Does that happen now?
Yes.
People smoke a pack a day. I don't know what you're talking about.
Exactly. So people
That
smoke
happens
a
with life
hold on, Jock. So people smoke a pack a day now. People already have unhealthy habits now. What makes it worse is that they're not actually gonna go to fix those habits because they can't afford it, even if they want to.
Yeah, so like most people,
Preach.
when they tell me that they don't smoke, it's like, oh, I don't want to get cancer, I don't want to do this, I don't want to have to deal with all these consequences. But when you tell people, yeah, there is virtually no expense to whatever unhealthy habits you have. You don't have to diet because you could just go and get, whatever Ozempic or whatever.
Correct.
That does not help you achieve healthier habits because there's no consequences of it.
Right. What's going to help you achieve healthier habits is actually education and changing our entire food and drug system, not just
But
not, people have
there's a
to
consequences, there's
not.
economic consequences.
Of course, there are consequences. Always going to be economic consequences.
No, but
Like
you're
there's the whole.
offering to remove
Can
the
I?
consequence.
No, no, I'm not. Because what's the difference between America and somewhere like France that does have universal health care?
The fact that French people are poorer.
Hold on, Juan.
I'll be right back, brother.
Everybody listen. One at a time. Okay, this is how I do it. One at a time.
Okay.
There are countries that have universal systems that do not have our obesity rates. So what's the difference between them and ours?
Americans.
Not you, Juan. Not you. I'm asking human.
Sorry.
Yeah, so I mean, I don't know about like the population in France. I don't really know how France works because like I'm just not a French person, but I guess that they don't have as much fast food or they don't have as much people to
There's a
make that
Mc,
assumption.
there's a McDonald's in the Louvre.
Okay, that's fine. That
Yeah, but what I'm
okay,
saying is like I'm
a
saying is that
McDonald's in the most popular place in France is
yeah.
not going to mean that, McDonald's is overly popular compared to America.
Yeah, it's not overly popular compared to America because we have a huge fast food economy and stuff like that. I understand that we
Exactly. So
have.
we have
I
more
understand. Hold
fast
on.
food.
Let me finish. Let me finish. I understand that Americans we have unhealthier eating habits, right? We also have unhealthier food because there's a bunch of sugar in it, right? So I understand those cases, right? What I'm saying is that a universal system actually does incentivize people getting healthier because then they would actually go see their doctors because they can afford it. Like typically, if I was able to see my dentist 4 times a year, I would. I only cut that down to 2 because I can't afford it. You see what I'm saying? So like if we actually had a system where people can actually have access to healthcare and access to health services, then we will see more people go. This is personal for me as well because I'm studying to be a clinical mental health therapist, right? The prime reason why people from my community don't go see therapists besides the religious part is because they simply can't afford it. But if we had open access to those type of services, you'll see a lot more people getting therapy, a lot more people seeing dietitians, a lot more people seeing cardiologists because it's going to be open and access to them. So why not open that access to them?
Yeah, I just don't think that the government is responsible to making like, conveniences for like let's say anxiety. That's not the priority of the government. That should never be the priority of the government to just give you a free therapist for like, every single person on earth.
Why not?
Because the government is here for other purposes, like to protect you and to provide public amenities that is enjoyed by all people, not extraordinary care. So, like, let's say if you were born with the extraordinary condition of schizophrenia, you're not going to be benefiting from those amenities if you're just a typical healthy person. So, with universal healthcare or at least subsidized healthcare, to like virtually where there's no consequence, economic consequence, a person who smokes a pack a day and lives a dangerous lifestyle is benefiting more from the system than somebody who just wants to be a regular person. They're paying for extraordinary people doing more dangerous actions and jeopardizing their health. Why should I pay for that?
You already are.
No, I shouldn't be paying for that tenfold.
Right. Are you paying or do you have an insurance carrier right now?
No, my parents, like it's through my parents. I don't worry about it.
Wait, your parents pay your insurance?
Yeah,
So why should your parents be responsible for you?
because they chose to have me. I don't know.
You understand how silly this makes your argument?
Like I'm not older than
You're not
26.
paying for your own health care, right? So
No,
like
but
so
somebody who
this
loves me is.
yeah, exactly, this
Somebody's
gonna
actively making the
this
choice to pay
this,
for it.
yeah, this could apply to the same government. Since the government, since we're under the system and we're under our government's protection, a government should provide for us, right? Provide for us some things that will make our lives better. Wouldn't healthcare do that?
Yeah, so my life would be better if I had a week-long vacation in Greece, but the government should not be doing that.
All right, but a week-long vacation in Greece is not the same thing as a healthy society. Wouldn't a healthy society be better for everybody?
I'm sure that is exactly why people should
Okay,
go to work
so
and pay for it
exactly, so
themselves to some
a
degree.
healthy okay, so a healthy society is a healthy population is good for society. And universal health care objectively makes healthy societies. So why shouldn't the government do that?
Yeah, because you're. Yeah, go
That's
ahead,
not
Juan.
true.
No.
That's a false
I
claim.
said one. It's one
Venezuela
at
has a
a
universal
time.
Yeah,
It's
well,
not
I
true.
think Juan can take.
No,
it.
I'm talking to you. You have 5 more minutes left.
Okay.
Juan, you could be next. All right.
Sorry,
So if we
it's
can
a
have,
time thing. Okay, sorry.
all right. So if we can have a more healthy society, why shouldn't we go that route? The only thing you have to be saying is that people just get up and work. That's all good and well. No one is saying don't work. The way that, do you understand how insurance works, right?
Sure.
The way that insurance works is that when you're paying that premium, it doesn't go into your little piggy bank at the insurance company, and when you make a claim, that money's for you. You're putting that money into a pool. So when you say that you don't want to pay for other people, you're already doing that, or your parents are doing that by pulling all their by paying an insurance premium. All that money goes into a premium pool. So everybody who's part of that insurance company, they're paying into that same pool, and then when one person has a claim, it gets taken out that pool. So when you say that you want to pay for other people, your parents are already doing that. That's how all insurance works. The only difference between what I'm saying and what you're saying is that you think this should be handled by private arbiters who are gonna want to make a profit, and I'm saying this should be handled without a profit motive. Otherwise, we'll see a situation like Luigi.
Yeah,
That's all I'm saying.
so I think that there are individuals in this country that would be better off and not really affected by the cost of, typical medical procedures. Like if there's somebody who's like even a millionaire, I don't think that it would be a, negative for them to be able to pay for their medical bills. So I believe that private institutions should have that motivation, that incentive to stay alive and profit off of those people who have no issue, maintaining their own health or being economically responsible for any accidents that happen to them or whatsoever.
Do you really think health is something that like you just try to do? Like you realize that it's not just on your own, right? Like cancer could just pop up out of nowhere.
Yeah, so like 40% of people in this country, I believe it's 40% are obese. And I believe that majority of those people, that's an active choice. They're raising their hand to grab a burger to be obese, right? So if
No.
40 no, if near 50% of these people in this country are obese and they're making the active choices to worsen their lives, that should not be coming out of my pocket tenfold. Like it's already
But
coming out of my
it's
pocket. I
but
understand that.
what I'm saying is that the way that insurance works is that this is how all insurance works. So I'm pretty sure the insurance company your parents are part of have obese people in there. They're already paying for it. That's how it all works. So when you said that you don't want it to come out your pocket, that's how insurance already works. So what are we talking about?
No,
The only difference between myself and yourself is I'm saying that there shouldn't be a profit motive because it leads to bad results, like what we saw with the universal healthcare situation, with the not universal healthcare, United Healthcare, like what we saw with United Healthcare. Like it led to bad situations where because they wanted to make more of a profit, people were denied care who should have gotten it.
Yeah, I
That
don't
should
believe
not
that
exist.
like these
All right, so
companies
exactly that should
should
not
be
exist. So
denied
there
care.
should not be a profit motive, and the only institution that does not have a profit motive is the government. Now, I'm not
No.
saying that private healthcare can't absolutely exist. You can have private healthcare for things like luxuries, like plastic surgery or breast implants and stuff like that. Yeah, sure, have private healthcare for that. But everything else, for your eye care, for your heart care, everything like that, it should just be universal. Like for example, my parents have hypertension, right? They didn't choose to have hypertension, just have it. So their healthcare is gonna cost more. Plus, my mom was a 30-year nurse. You're saying that her hypertension plus being a 30-year nurse is she's choosing to live a bad life, so she just be lazy and not work? You know what I'm saying? It's silly here. Like some of these issues just pop up.
Yeah, so I believe that the solution to like the United Healthcare situation where they're denying claims, the solution is to put more regulations on private institutions, not to remove the competition by the government, wholly taking accountability
But the
for general.
competition hasn't done anything. The only thing that we've seen is that healthcare has gotten worse, and private actors have gotten worse at doing it.
Yeah, so the solution, I believe that the solution should be is to, put more regulations on private institutions rather than, making it so that the government is responsible universally, straight out the bat for every single individual.
They're not responsible for you personally. It's just that
Yeah.
when you go to the hospital, you don't have a bill. That's it. They're not responsible for you. Like if you go out bike riding and break your ankle, the government didn't do that to you. You're just not gonna get a large bill for your knee surgery.
Yeah, but I believe that I should be able to pay for that, injured leg because I assumed the risk of going outside on a bicycle. Nobody told me to go on the bicycle. Now somebody else has to pay the federal government, or at least even more for the
You're
federal government.
paying it. You understand how
Okay,
insurance works, right?
I understand that, but I'm saying more so
No, no one is
federal,
paying more
federal.
so.
No, in if there were to be universal healthcare system that just completely eliminates medical debt and all these
Yeah, let's eliminate medical debt. Why we should not? Why should we? The number one
should
reason
we?
people go bankrupt in this country is because of medical debt.
Yeah, I know. But I
Yeah,
believe that,
that shouldn't be a thing. Let's get rid of that. Why would
yeah,
we? Why do you believe in medical debt? Why do you believe in bankrupting your fellow Americans? That's
yeah.
kind of
So when we
silly.
see that mostly a near half of this country is making unhealthy decisions like being obese, that increases risk of complications. So we see that the most
You
people,
realize that obesity is much more complicated than motherfuckers grabbing a burger, right?
well, I would say that for the loud majority of people that I've met who are obese, they're grabbing burgers,
I
multiple of
understand
them,
that's the
not
majority of
enough.
people that you've met. My three little cousins were born obese. They just fat. That's just them. They were just born that way.
It was just magic. They just like magically
And
just had all this.
yeah, they were born fat. They were born
Yeah,
12
okay.
pounds. They were born
Okay.
12 pounds, and one is 12 years old right now, and he's 5'9" and 230 pounds. They're just born fat.
Okay,
He's
maybe they,
12.
yeah, maybe they should work out, or there's some sort of like hormone disruption that's causing this. But regardless, I do believe that, it could be avoided. Obesity is one of those things that could be avoided, but people are willingly putting themselves into circumstances, especially when they're adults. It's
Yeah,
not,
that's not.
the child.
Yeah, I understand that for a lot of people that's how it is, right? And
Yeah,
I gotta let you
so
down right now.
yeah,
For a
so
lot of
if
people
people are
that's how it is. I understand that we can do healthier eating habits, which was Michelle Obama's entire plan, by the way. But like I understand that we can have healthier eating habits. We could have a healthier food choices, right? Like one of the issues that cause obesity is again, sugar is in everything, right? No matter
yes.
what you buy, sugar is gonna be in it. So we need to regulate the sugar industry in order to decrease our obesity. We need to regulate a lot of preservatives that go into the foods, right? But all that has to do with government regulation, which is why other countries are not as obese as us because they don't have the same type of materials in their food that we have in our food.
Yeah.
But the second thing that I would say on top of that is that I don't see a reason why would universal healthcare be some sort of bad thing if we're all already doing this? The way insurance works is that we're all already paying for somebody else. That's the way it just works. The only difference is I want to take it with a profit motive, but you want the profit motive that actually causes serious harm, and I don't
Yes.
understand that.
Yeah, so when somebody like gets like United Healthcare, this is not something that is the government, right? So the taxes that, or at least the tax consequences of universal healthcare where the government would assume the risk or I mean assume the debt of all these people who are in like hospitals, right? That would lead to increased taxes. Like how would this work without increasing taxes?
Open up Medicare for all.
No, I'm saying like how would this work without like affecting taxes at all? Do you think
Open
this
up
would just be
Medicare for
tax
all.
neutral?
But it has to be paid for.
Hold on,
Somebody
Buck.
has to
Hold
pay
on,
for it.
Buck. Hold on, Buck. I just said everybody one at a time. Yeah, open up Medicare for all.
Okay, so
If
Jeff
we were to
Bezos.
say that Medicare is no longer for people 65 and up, anybody who works can access their Medicare. What did you just pay for? What did you spend on? You didn't spend
Wait,
on
so
anything.
should Jeff Bezos right now
Yes.
be given free treatment, like
Yes.
100% free treatment?
Yes.
Like, why should he have
Yes.
zero economic responsibility?
Because we all benefit from a universal system. We all benefit from it. So do you. I want you to have health care. I want the entire pound to have health care. I want Jeff Bezos, and I don't fuck with him, to have health care. Even Elon Musk, if he's an American citizen, should get universal health care. Everyone.
So you're not advocating for based systems. Like you're not even looking at needs. So
No,
you're
everyone should
advocating
get
for
it.
extraordinary care. So the people who are
This is
in
not
this,
extraordinary care.
no, it's
Most people are not going to be going into the hospital with like a leg implant or something like that.
wait,
They're going to
hold
go in
on.
for their
This
regular
this is
checkups
what
and
I
shit.
mean by extraordinary care. I'm not talking about like jumping off of like a skyscraper. I'm talking about the extraordinary care is somebody like 40% of America's obese. It's an obese person sitting down, doing nothing, smoking smoking a pack a day. I've
That's
seen
not most
numerous
people. That's not
I'm
40% of
still-
people in America. Like that's not 40% of people in America. You understand that how obesity, like for example, if you were to see my mom right now, right, you wouldn't call her obese, but technically she's considered obese because of her height and weight. You know what I'm saying? But you wouldn't call her obese. I'm technically obese from my height and weight. You see what I'm saying? But it's like if you look at me right now, you wouldn't call me obese. So like obesity is like when you say 40% of America is obese, we have to actually see what we're talking about here, because those 40%, they're not the people that you see on 600-pound Life. You know what I'm saying?
Okay,
They're usually like regular people. You might be considered obese and you
No,
don't know.
I'm
You
not
see what I'm
obese.
saying? So I'm just using that as an example. But like what I'm saying is that most people that are considered obese are not the people you're gonna see on 600-pound Life smoking packs and eating burgers. That's not 40% of Americans. That's not
No,
them.
but my issue is like, when it comes to fairness, it is just not fair. Imagine this. There's somebody, you never see him just, get off his porch. He's always sitting down, smoking a pack a day. He's an alcoholic. He's making the active decision to ruin his physical health. And then his next door neighbor is riding a bike every day. He's eating vegetables. Now, the government is going to put more taxes on that person for him,
No, they're
the next door
not.
neighbor, to receive care for actions that he put
No,
upon
they're
himself.
not.
They raise their hand to
When
smoke a cigarette.
when
I
it
don't
when
want to pay for
human
people who
listen
have
listen
cigarettes.
listen to what I'm saying to you. Universal health care means that we're all paying into it. They're not going to raise taxes on you because an obese person in Podunk, Iowa wants to smoke a pack a day and he has no taxes. That's silly. Universal health care means we're all paying into it, not
No,
just
I
a few people. This is
Okay, so
dumb.
most people, they're paying for this. They're paying for their healthcare through private entities. But now, if you want universal healthcare, all this debt to be assumed by the government, how would the government somehow say, okay, yeah, it's just not going to have any responsibility on the
Open up
taxpayer?
Medicare for all, because every working person pays into Medicare.
How much would that cost?
So drop Medicare from 65 to 18 and whenever you're working.
How much would
Boom, you
that
can
cost?
access your health care.
How much would that cost, and how much debt would that bring us into?
What open up Medicare for all?
Yeah, how much would that cost?
Last I checked, I think what was it, 3 billion a year? Last time I checked?
3 billion a year.
I believe so. Last time I checked, I could be mistaken though. So don't take my
Yeah.
word for it. All right, we're actually already over time, human. So I got to go ahead and
All right.
and drop you. But I do appreciate you being up here.
Yeah.
All right, you guys, go ahead and keep liking the live, keep sharing it. Welcome, Dr. Joe, to my live. Dr. Joe is one of my mods.